Medical Center continues to face controversy after reportedly firing a longtime emergency room doctor after he spoke out publicly, questioning how prepared the hospital was for COVID-19.
We're not protecting our staff very well. We're not protecting our patients.
Tonight, we're hearing from St. Joseph's nurses who say they support Dr. Ming Lin and are deeply saddened that he will no longer be working with them. Their focus, though, is not to criticize their hospital. It's to educate the public and get the support that they say is desperately needed at every hospital. Q13's Olivia LaVoice has their story.
Within the last week, we've heard from several nurses from St. Joseph's Hospital in Bellingham that have echoed the same concerns as healthcare workers nationwide.
We have less than adequate gear to protect us as well as our patients.
You're hearing from a veteran emergency room nurse who's asked we protect her identity as she fears speaking out could cost her her job.
It's very hard to perform your job in a loving, caring manner, knowing that at any point in time you could be contaminating yourself.
The nurse we're calling Jane mirrors concerns we heard from Dr. Min Ling before he was fired. While the staff is given some PPE or personal protective gear for certain patients, they aren't given it for every single patient the hospital sees.
Every time I go to work, I think, is today the day that I'm going to get exposed to a COVID patient without knowing.
Jane says in the ER, nurses are given an N95 mask per shift that she wears all day. Over that, she wears a homemade mask and a face shield she purchased herself. She also recently bought herself a Tyvek suit because she feels the paper gowns aren't adequate.
I would do it again every single day if I had to, just to keep myself safe.
This message was projected onto St. Joseph's Hospital Friday evening. Provide PPE, honor and protect frontline workers. Bellingham local Debbie Cantrell says she was the one who did several projections that night at St. Joseph's. Cantrell is a volunteer with the Backbone Campaign, a group that describes their work as artful activism.
And it's not just St. Joe's. I don't have any beef with St. Joe's in particular. I think it's a nationwide problem.
We need that support right now.
St. Joseph's nurse Nancy Hill has been spending much of her time recently gathering donations for her colleagues, from food to flowers to cards.
Especially cards, because the staff can't have visitors right now. And especially those that do have COVID and that end up passing away by themselves. We are the ones that hold their hands as they take their last breath. And that's very difficult, to take home. Because we will carry that forever.
Nancy says the support from the community, from PPE to little things to cheer up staff and patients, truly makes a difference.
We're scared, and this is a very scary time, and people are dying. They're losing their lives. People are getting fired for speaking out, and I'm not here to speak out against my hospital by any means. I'm only here to speak out to the community and to rally support that we need.
A representative for the hospital said today they are actively coordinating with local and regional manufacturers who are producing PPE. Nancy says she's appreciative for that, and she says she and all the nurses are dedicated to serving. They just want to feel protected, which is why she's speaking out.
I'm so sad that nurses are afraid, because they are. They drive home in tears because they're afraid to bring this to their family. It's absolutely appropriate that people are afraid. We should be afraid, but we shouldn't panic. We need to do the right thing. And first and foremost, telling the truth is the right thing.
Olivia LaVoice, Q13 News.
Nancy and the other local nurses we've talked with, they want you to know how much your donations and your support really means to them. So if you're able to donate or show a sign of support for healthcare workers in any way, they say please do it. Keep it up, because it definitely makes a difference. And a big shout out to all the respiratory therapists out there on the front lines of this too.